Hello, everybody. I'm Julie Lytle. I'm the Director of Distributed and Lifelong Learning at Bexley Seabury Seminary and the former Executive Director of Province 1. I am so happy to have this special edition of Deacons Talking available for you all. Jan identified that she thought there was an important need for us to rally the deacons to hear what's going on in response to the virus in each of our contexts. And so we're glad that you were able to jump on with very short notice to be a part of this. Just to be aware, this is co-sponsored by the Association for Episcopal Deacons, Bexley Seabury, Province 1, and we're happy to have people from across the church being a part of it. There are a couple of quick housekeeping. We would ask you all to stay muted. There will be times throughout the conversation where Jan and Connie will invite people to share things that are happening in your context. And to help us to know that you have a story to share, we'd ask you to please raise your hand. Those buttons are under the participants' names if you open the participant box. So raise your hand, and when your name is called, that will be the time to unmute yourself and to be able to join in the conversation. When you're finished speaking, I'd ask you to say the name of the person that you want to pass it back to, probably Connie, just so that we know for sure that you're finished. So welcome again, and I'm going to turn everything over to Jen and to Connie.
Thank you, Julie. So I'd like to start with this prayer that was adapted from something that Bishop Thomas Brown of Maine has created. So let us pray. Jesus Christ, you traveled through towns and villages, curing every illness and disease. At your command, the sick were made well. Come to our aid now in the midst of the global spread of the coronavirus. Heal those who are sick with the virus. May they regain their strength and health through quality medical care. Heal us from our fear, which prevents nations from working together and neighbors from helping one another. Be present with those in authority who are making hard decisions. Support the medical professionals, emergency responders, and our caregivers. In your name, Jesus, we pray. Amen. So this is an idea that came to me based on the practice of open space technology that we've used at many of our conferences that we've been at over the last 10 years or so. I thought, as one of my deacons was talking to me, we were on a town meeting last week with our bishop. We were having town meetings with the bishop once a week. And the deacon texted me well, not texted me, but wrote to me in the Zoom box, the chat box, what are we going to do here in Rhode Island? And I thought, I don't have a clue what we're going to do here in Rhode Island, because we were already being asked to stay inside our houses, et cetera, et cetera. And so people started battering ideas back and forth. And I thought, you know what, somebody in this country, deacons are the most amazing people in the world, if you ask me. So I knew that there was some deacon someplace who was doing something fabulous, outstanding, remarkable, that we could all benefit from hearing about. And so I reached out to Julie and asked her if we could have a walk on the road to Emmaus, Deacons Talking on the Road, whatever, to Emmaus. And she said, yes. So that's what we're doing. We're gathering together with faith that this might work, and with gratitude, even if it doesn't work, because of the number of people. I'm not surprised at all that there were 60 some that registered. I don't know what the number is right now, but there are a lot of us online. And so I thought that we could, number one, hear if people have started to do some kind of a ministry, even with lockdowns and whatever is going on, if there is some kind of ministry that others might be able to duplicate, then that would be awesome. I know that the whole concept of laundry love exists on the East Coast because people talked about it across the country. And when it got here, all we had to do was really copy it and make use of hard work from other people. So we would like to hear your responses. And if there aren't that many things going on that we have time to talk about what we might do, then what is it that we could do to support ourselves as deacons? the priests are caught up in buildings and online services and things like that. And I'm not exactly sure what we're doing, but is there something that we could do to support one another? So the other thing I wanted to say is please write down my email and Connie's email so that if we don't have your contact information because you're sharing this video with somebody else, 2 or 3 of you are gathered together, then please email us and let us know your contact information. And or if you had something to say tonight that for whatever reason we weren't able to hear from you, please email either one of us, actually email both of us and copy us so that we can continue to try to figure out how we might share information across the board. And lastly, at the end, I'd like to, before we close out the call, which will be about an hour, I would like to close out the call finding out if people think that this would be something worthwhile continuing on a weekly basis if necessary, or a more regular basis. So that's kind of where we're at, and we're flying a plane that hasn't been built. So with that, I'd just like to briefly introduce open space technology, thinking that most of you know what this is, but the goal of open space technology is to create time and space for people to engage deeply and creatively around issues of concern to them, our issue being the virus that is taking over the world, actually. And it's an opportunity to invite people into conversation about things from perspectives most meaningful to the participants themselves. And there are principles and one law. The 4 principles are whoever comes are the right people. So if you're questioning whether or not you're to be here, the answer is yes, you're supposed to be here. So that's taken care of. And whatever happens is the only thing that could have happened. So nothing about this evening can be a failure. Nothing, it will be what it is. And when it starts is the right time for it to start, and when it's over, it's over. The only law is that if you find that it's not right for you, it's okay for you to leave the meeting. We aren't taking names and addresses, and there are no Deacon police that will look you up to find out why it was that you left. So if it's not working for you for whatever reason, technology or content, feel free to leave. And I hope that it is meaningful for each of you. Now, what I'm going to do is I'm going to jump over to Connie, and Connie is going to be leading the conversation, and I'm going to be the note taker, because every good open space technology is supposed to have a note taker. So that's what we're going to try to do. And Connie, it's all yours, my dear.
Okay, so I'm a deacon at St. James Episcopal Church in Bozeman, Montana, and we have 2 things that we are doing. The first thing is that we, of course, in Montana, we still have snow on the ground. Probably many of you do. But our warming shelter was no longer able to meet any of the requirements. They couldn't keep people 6 feet apart and in the public space. And so they decided they needed to outfit everyone with tents and sleeping bags and tarps, and basically get everybody ready to be outside that was homeless. And that was a huge piece of consternation for us. But what we did was we called all of the pastors together from our interfaith group. So not just the Christians, but all of our Baha'i and Mormon, all of the groups. And we all met together with the social agency that was coordinating that. And the best thing that we could do was to put it out into all of our people that we needed this need immediately to be met. And one thing that came up was I found out that any person can actually petition their National Guard unit or their disaster and emergency to be able to find really high quality tents and sleeping bags, that kind of thing. And we ended up not using that, but for later reference, that includes things like mobile showers, mobile toilets. So there might be an opportunity for you to get resources there. In the meantime, my wife and I, she's also a deacon, we have decided that we would offer a daily noonday prayer and a daily Vesper service. So we are doing that streaming live on our Facebook page from the church. and we're getting lots of hits. People are seeming to want to come online and have some other kind of contact, particularly a spiritual contact. So that's what we're doing. I'd be happy to entertain anyone else who would like to share. So just raise your hand and I'll call on you. Or if you have questions. Yes, Marilyn. You'll have to unmute yourself.
I just did. I'm Marilyn McMillan from Cape Cod, Massachusetts, and we have a stay-at-home order going into place tomorrow at noon for the next couple of weeks. And in advance of that, our parish at St. David's ran our monthly paper pantry and takeaway meal this past week in a new way by delivering the supplies to people as they pulled up in their cars. During that 2-hour period, we served over 50 driver-uppers, and those folks represented over 170 members in their households. We had a bunch of new arrivals this time, which suggests to us that the economic hardships are already hitting some of our neighbors here on the Cape, and our next challenge will be to figure out how to continue that service next month, especially if the stay-at-home order is still in place. We're also offering noonday prayer through the parish. As far as deacons supporting one another, our Bishop Suffragan, Gail Harris, to whom all of our deacons in Massachusetts report, convened us in small groups using Zoom this Saturday. And it was a very successful time to, just in groups of like 10 of us, share what was going on in our parishes, in our families, and within ourselves. And we've agreed that we want to continue doing that about once a week as we move into this crisis. In addition to that, the diocese has assembled all clergy, deacons and priests, in a couple of region-based conversations with the advisory group that Bishop Allen has pulled and Bishop Gale have pulled together to advise them in the crisis. So we were able to get really up-to-date information from epidemiologists and other experts in disaster management and share that with our vestries and other parishioners, and that was very helpful.
Marilyn, I'd like to ask you, how do you deal with the issue of the volunteers touching the food and packing the boxes? Are you doing any kind of disinfecting before you hand that box off to a family?
Yes, and we're all using gloves as well, and we're maintaining distance. We were actually putting we used grocery bags, and we used disinfectant, and we're putting the bags in people's trunks or not necessarily handing them. So we're maintaining pretty good distance. I don't know that it's 6 feet, but it was pretty good distance.
Thank you very much. Catherine, would you like to share something?
Yes, I would. Some of the people might have been on the meeting that we had in Virginia with Governor Ralph Northam. And the last name is Ferguson, F-E-R-G-U-S-O-N. They have now changed the recommendation from no more than 10 people to a mandate for no more than 10 people. That's one item. Secondly, don't know how many people are being able to provide services for our Spanish-speaking people. I work at the Iglesia de Santa Maria, and we are broadcasting at 9:30 every Sunday in Spanish. It's a modified Eucharist service, it goes up to and not including the consecration and youth and distribution of the body and blood. But it does have all the readings. It does have the gospel preaching. So it is all done in Spanish. So that's a possibility. I'll send you the link in the chat.
That's just what I was going to ask about the link. I don't know if any of you know, but you can actually order online pre-filled cups and wafers. They come separately wrapped. We are planning on consecrating those for the vigil and for Easter service. You can get like 250 of them at a time if they still are available and if they are still able to be shipped on time. But the group that I ordered this week, we're going to be getting by Palm Sunday. All right, I see Bonnie Matthews with your hand up.
Okay, I can see that I got my mic off now. I have a floating bubble that always covers the mic. I'm sorry about that. I have a question for Marilyn because we're looking at how we're going to work with food pantries and distribute the food. Is this food that's going to families or food that is going to people who are displaced from their homes, number one? And number two, do you have a list of things that are going into the bags so that the bags are standard? And if they are for people who are displaced, homeless, who are displaced into a temporary home, are there instructions for what to do with this food? And maybe you can get that to Jan for the notes, or we can answer it now. It doesn't matter to me.
Well, I can do a quick answer right now, Bonnie. We had both folks who are supporting families in their own homes and folks who came for meals for 10 and in another case, a dozen people who were being housed in a shelter. The meals are very standard and there's each separate component of the meal is separately packaged. And there's only one kind of food that we distribute each time we publish the menu in advance, and people can pick it up or not. Normally, when we're doing it inside, people can make choices. No, thank you, I don't want the potatoes. Yes, please, I'll have another orange. But when we were doing the running to cars, we were distributing sets in grocery bags that had been prepackaged for the numbers of people. We had bags of 1, 2, 4, and so on. Similarly with the paper goods, the paper pantry is an important part of our ministry, and that includes all the things that people aren't allowed to buy on food stamps. We've been doing this for about 3 or 4 years.
Oh, I thought maybe when you said paper, it meant you had extra toilet paper.
Well, definitely there's toilet paper, but there's also sanitary supplies and razor blades and shaving cream and toothpaste and paper towels, so on.
Thank you. In Connecticut, the Deacons are, the Deacons Council and our Bishop Laura Ahrens, we are having a gathering via Zoom tomorrow night, and we've reached out to all of the deacons as well as the entire diocese, because we want to gather information about what programs are still active related to caring for the homeless, for food pantries, and for soup kitchens, so that we can have an assessment of what's going on and hopefully get people gathered together in their different regions to be able to work together and improve on what's there. I think that as we go into this virus, we are going to have fewer people who may be able to participate because they've contracted the virus. So we're sharing ideas, we're finding out what's out there, and we're going to share that news and then figure out how we're going to move forward from there. But one of the questions from one of the deacons was specifically about what are we getting into the bags, and whether or not if they were for homeless, was it cooked food or was it food that they can go back to their temporary shelter and add water to and heat up? So we're kind of looking for some of that information.
Bonnie, can I just ask you, it turns out that all of our ministries that our church had were like, for example, working at the cafe to help feed the homeless and go to the showers and help them get showers. The volunteers have actually been restricted here, and no churches are being allowed to actually participate in any of those programs. The staffs of those programs are trying to handle it, which is a huge issue. The only thing that we have been able to do is we normally host a family promise. I'm not sure, it was called a hospitality network or something like that on the East Coast. But instead of having the families who are homeless rotating, our church opened up our rectory so that all the families are staying in one place for the entire lockdown. So for the next 2 or 3 months, we're expecting the families to stay in one location so that they can control that. But I think it's an issue that you may find that your people volunteering are going to be restricted from volunteering as much as we normally have. Have you found that at all?
Many of the parishes that had actual food pantries and did serve meals have stopped because we are under our emergency. We are not gathering more than 10 people at a time. So that is a large restriction, but we're trying to also find out if people are already working with different agencies in a region and where they can source to get food, so that, by example, our cathedral is still handing things out, but they're not doing it indoors. And they are spacing the recipients so that they're not close to one another, and they're going through and they're getting handed a bag, much like a situation with a car.
So one of our issues here in Montana was that with all the restaurants closed, many of our homeless were not able to actually get food. And so what has been suggested to the churches is that we buy food cards for those people, that for all the restaurants that are doing takeout, that we allow them to be able to be handed gift cards, if you will, so that they can get those places, they can still get food. And the thing that we're looking for right now is, how do we provide facilities for our homeless to be able to do the proper hand washing and to have a place to rest during the day, because all of the public places, including the malls, are all completely closed down. And some churches have actually even made edicts that are not allowing their churches to be used for anything. So if anybody has an answer to how to create rest areas for the homeless or the people that are outside right now, we'd appreciate it.
Yeah.
I saw a conversation, Bonnie, if you're done, I saw a conversation that Teresa Llewellyn was having. Teresa, could you please speak to that? And then we'll have Sally Maurer speak.
Sure. And Holly Handbeck, also from the Diocese of Virginia, and I were on the same webinar. Virginia Theological Seminary held a 2-day webinar on observing the Triduum in a time of quarantine. And it was presented by their liturgics professor and one of their formation professors, who talked very much about braiding formation and worship together and liturgics together during the Triduum. They have put together some resources for in-home worship, how to help people set up sacred space, how to have them do some of the services at home that we would normally be doing in church. And the other piece of that is they have modified some of the liturgies using the Book of Occasional Services, the Book of Common Prayer, and some Lutheran liturgics leaders have put together other services for the Triduum in particular. Really, I highly recommend it, and there are a couple of them, a couple of other people commenting. It was an excellent webinar. If you can get it, it was free. If you can get it on the vts.edu website, I highly recommend you look at it, because they do not think we should be creating things from scratch, recreating the wheel, and really stressing ourselves out about things that are not really what we do on a regular basis. So I would commend that to you.
Would you please put that online, the link of where we can get those resources?
Certainly, we'll I'll look it up and put that there. And if Connie, is it okay if I talk a little bit about what's happening in Northern Virginia, in my part of Northern Virginia?
I think, Sarah, did you have something you wanted to contribute to what Teresa just said about the Triduum and the VTS seminar?
Yeah, I would. I just agree with Teresa, and I loved the overarching message, which was we need to remind ourselves not to overfunction at these times, and to be just present in the moment. And the mission of the church is to form people so that they can receive what God wants to give them. So it's not about so much how to do it really well. It's about how we can form people so they're able to receive in totally different times of uncertainty. And I really personally appreciated the reminder of that, because I think by nature, we're all wanting to dive in deep and try and recreate what we do, especially in the Triduum, and think more deeply, what is essential about our faith? And we have a God who is all things to all people.
Yes, thank you, Sarah. That's lovely. I'll ask you, Teresa, to come back and tell us, and then we will get to you, Sally. So just a moment longer.
Or thanks. And thanks, Sarah, for that reminder, that helpful reminder for all of us. Bishop Susan, our ecclesiastical authority in Suffragan, has asked the deacons to continue the ministries that we have as best as we can while being safe. And in my part of Northern Virginia, the middle school kids get hot meals in the after-school program, and our parish participates in that. So we're working with partners that we never have worked with before, in addition to the school, to pull together extra food distributions for the whole family in the apartment complexes. And one of those partners is the mobile dental clinic. They can deliver meals. They have been delivering food packages, I should say, to apartment complexes, and they're willing to add days to that. So if you have groups like that, they are working with Food for Others, which is very much like No Child Hungry, No Kid Hungry, if you have those in your areas. But they have very specifics about their food. So we are providing funds out of the money that we normally would spend for the hot meals after school. We're just sending the funds for them to purchase food. They're finding that the grocery stores here cannot keep up with the food demand, so they may not be able to make donations to the process like they normally do. And the food banks apparently are having difficulty. However, just so you know, the USDA is releasing more commodities to feeding programs for kids. We heard that from our governor this evening, and that's across the country. So I just wanted to mention that we particularly are partnering with people we haven't normally partnered with in the past, and I think that's a great thing.
I think that's something that we've noticed too, Teresa. When we're live streaming our service, we are getting people that we have no idea who they are. I'm seeing this as a real opportunity for us to be introducing who we are and what we are through this time, because people in the comfort of their own home are logging on and viewing this. I think it's a cry from the general public for some spiritual foundation. Sally, would you like to say what you have on your heart? You've patiently kept your hand up.
No problem. Can you hear me okay?
Yes.
Okay. So my name is Sally Maurer, and I am deacon at St. John's Episcopal Church in Salem, New Jersey, in the Diocese of New Jersey. I'm also a nurse practitioner, still practicing, and I go to people's homes. So I am in a position of still being out there as one of the people that are frontline managers of our sickest and frailest elderly. At our church, we have a food pantry. We provide a day's worth of food, breakfast, lunch, and dinner, all dried goods, all shelf stable. We have enough food for tomorrow, for Tuesday. And then our supplier, who we've been getting the food from, has indicated that they will not be able to help us with everything on our list. So we too are probably going the route of getting some gift cards to give to the approximately 90 people that come to our door. Last week, a younger member of our parish handed the food bags out the door to people, keeping distance. They didn't come into the parish hall. Our bishop has mandated closure of everything. NA and AA are also having to reorganize themselves, where they meet online, virtual, but not in our parish hall. We began we had our very first Zoom church service evening prayer yesterday at 4 p.m. We had about 16 people from our church participate. We considered it successful, including music. We all did it remotely. I did it from home. Our minister of music hosted it because he teaches at Temple. He knew how to work Zoom, and I'm too old to figure this stuff out. Anyhow, I decided last week to begin offering prayers of the people emailed to my congregation. I should have added at the beginning, our priest has been out sick since long before COVID-19. And so the congregation, pastoring the congregation, has sort of fallen on me, as well as our outreach ministries. So every week they are receiving annotated prayers of the people with all of the names of sick, shut-ins, people that are on our prayer list, as a way of keeping us united in prayer. I have undertaken calling all of our shut-ins at our parish, and I also am assisting 2 other Episcopal parishes in the area. I have the list of shut-ins for one of the parishes. The other parish has not responded with a list, but it's my intention before the week is out to check in with all of the shut-ins to make sure that they're okay, that they have somebody designated who can get things for them, In our congregation, I had a call with a medical need, and they needed something from the pharmacy, and I called another parishioner who lived closer to them than I do, who went to the Rite Aid and picked up what they needed and delivered it to them. We are on, we're all supposed to be sheltering at home, but we are allowed to go run errands, go to the store, things that we have to do. I'm allowed to go out to see patients. That has not been stopped. Our bishop, just so you know, has indicated that we are fasting from the Eucharist, and he has live streamed a Eucharist. I should say it was Facebook Live and YouTube on Sunday at 10 o'clock from our cathedral, and he deliberately refrained himself from receiving the Eucharist after it was consecrated, and offered a prayer from St. Alphonse for spiritually receiving communion. I find that very useful. I thought it was somewhat offensive to think about the priest receiving communion and people that were there when the rest of the congregation could not receive. And apparently the bishop felt the same way. He is taking kind of the desert fathers and mothers mentality on all of this. I just thought I would share what we were doing.
Sally, that's an absolutely wonderful, and it helps me because we've had this conversation with our priest as well about what does it appear like when the priest is taking communion and no one else can. So you just gave me some really good words, taking a fast from Eucharist. And if you could share that prayer of St. Alphonse, that would just be lovely. I'd appreciate that. Thank you very much.
All righty.
I see, Paul, that you have your hand up. Would you like to share?
Yes, thank you. I would say much of what Sally just described regarding the pastoral care needs is happening in our diocese. I'm from the Diocese of Fond du Lac up in Wisconsin. And what many of the parishes are realizing is how inadequate their directories are, and being able to reach everyone, having correct phone numbers. For the most part, I think addresses are okay, but what we're finding is that we're having to drive around and find out the best contact information so that we can reach out to everyone. And it was pretty much a resounding concern across the diocese. So that's been an uphill battle with pastoral care needs. And in my parish, in Sheboygan, I couldn't imagine having to contact everyone myself, and let alone with myself and our interim rector. So what we've been doing is we've commissioned what we call shepherds, about a dozen people within the parish to reach out to they each have a selected amount of people to reach out to each week with 3 questions that we've been tasked them with. The first one is, how are you physically doing? Do you have any symptoms? How's your health? The second question is, are there any needs that we can fulfill for you? Maybe someone can go to the grocery store or the pharmacy for you, or get in contact with anyone for you. And then the third one is just emotionally, mentally, how are you doing? And we found that with a lot of these shepherds, they didn't have any real experience with pastoral care. And we envision that these phone calls are not going to be just these 3 questions. They're going to be much more than that. And there's going to be a lot that's going to come out of the conversation. So we have started with kind of a prepping of kind of having them understand that, don't put all the burdens on yourself, some of those basic pastoral care criteria. And and really to be able to pull the information together, and then if further deeper pastoral care is needed, having someone contact that person that maybe has those skills or those gifts. And right now we're trying to track it all in kind of a Google Doc spreadsheet, the different needs and gaps and stuff like that, so we can track it. And it just got started, and so we'll see over the next week or so how successful that is. And a lot of what Sally described is happening in our state and our diocese. So we're on a Lenten fast of communion going forward. We've been encouraged very much so to have received communion spiritually. There's a wonderful prayer and Eucharistic liturgy from the Order of Julian of Norwich up in northern Wisconsin that order put together. They are a very enclosed and isolated community. And they're going to be continuing the practice of Eucharist on a daily basis. And the liturgy that they wrote, it calls in there the action that I receive the communion spiritually while it is now being physically received in that place. And so for me, it has offered quite a deep connection to the physical act while I'm far away. And I can share with that a link to that document with you guys in the chat. But the last piece I wanted to touch on is the idea earlier that you had noted from the VTS seminar about overcommitting and putting too much on yourself right now in these days. Personally, my wife and I are working from home, and in addition, we're now teachers with our kids at home, homeschooling them, and I kind of feel at loss right now, hoping that I can do more and get out and do the physical things that I was used to doing with people. And now we're under a shelter-in-place type of directive from the governor that starts tomorrow. And it's a very weird feeling not being able to interact with other people, but we're doing the best I can and keeping ourselves safe. So thank you everyone for your suggestions so far. I'm writing lots of notes.
Thank you, Paul. I think that's something we discovered too, that getting an accurate directory of our parishioners, finding out that some of us had numbers that were disconnected. It's been a little bit embarrassing, but we divided all the pastoral staff divided all of the congregants up. At first we were going to just do the elderly, and we just felt like that we had families with children that were suffering, so we decided to call everyone, and then we're going to rotate the list. So we divided it into 4 parts, and then whoever's got number 1 moves to number 2 the next week. So you get a different person calling the people, so they're hearing more than just one voice. But that's an excellent suggestion. Thank you. I'm going to call on Roxanne Klingensmith next, and then Bonnie. So first, Roxy.
Well, good evening, everyone. I'm Roxanne Klingensmith, otherwise known as Roxy, from St. James in Bozeman, Montana. And my ministry is to go to the local detention center every Monday and visit inmates. Most of us know that should COVID-19 hit these facilities, it's going to be devastating. We happen to have a sheriff that I think is pretty enlightened and sees visits from volunteers such as myself and other community members as taking the anxiety and a lot of the nervousness away from inmates. But this last week, I think they decided that we ought to probably not go in. And I've said all along, it's not that I'm afraid to get anything, I just don't want to carry it in there. So with permission from the sheriff and the jail commander, those of us who have been going in are now going to be allowed to write. those who are incarcerated. And so I spent the weekend thinking about the people that I regularly see and have sent them letters today. Actually, I used the icon of the diaconate, that little thank you card, and slid a letter in that I did on the computer because I wanted to write more than just my hand could take. So those have all gone off, and that's my my commitment to them, is to write them every week. But I'm also collecting. I don't know how many of you belong to the Henry Nouwen Society, but every day Henry Nouwen Society sends out beautiful thoughts from the book he wrote called The Beloved. And they're wonderful, and my inmates have gotten pretty used to me bringing those in. And so I'm collecting those and probably going to send those along the way to lift up their spirits. One of the things that I know my inmates know is that I care deeply about them and what is happening to them. And because this is a population often that we like to throw away, I want to make sure that God isn't interested in that. So that's one thing. All of our visits, Connie and I regularly visit Montana State Prison, and all those visits have been canceled. I want to say a couple of other things. One is that we have created a volunteer corps at St. James, remembering that we are to equip the faithful. And so we have quite a list gathered. And so as we make these phone calls for clergy and these names every week, we'll be picking up requests and sending them to this volunteer corps that will go out and do that. And involve them, because really, quite frankly, they're ready and willing to do it, and have a pretty good handle on what to do. So we're trying to involve our congregation deeply in this situation. So anyway, that's kind of what we're doing, or I've been doing at St. James. And I would ask that you keep people who are incarcerated in your prayers. Remember them. They are, for the most part, people who are dealing with co-occurring diseases. So thank you very much.
Roxy, I have a question, point of clarification. You say that you're sending volunteers out, but you are on shelter in place, right? I'm not exactly sure how all that is working.
Well, that's a really good point. We haven't done it yet. We haven't sent them out. We're gathering names. And as a matter of fact, on Wednesday, our clergy meeting will be held, and we'll be discussing this. You make a very good point. We are encouraged at this point to stay at home. And as far as the diocese is concerned, we are not holding services. So I think that's something that we have to talk about. And we right now are just gathering names and have not put anything in place. But I thank you for your question, because we do need to discuss what we're going to do.
I think the plan originally is that we just leave something at the door. Yeah. And not go in, not have a discussion with the people, but simply leave it at the door. I know that one of the calls I made, one person wanted to have what we call here the 5 wishes. It's the advanced care directives that the hospital gets. And she wanted to make sure that if she got ill, that everyone would know that she did not want to have a respirator used, that she wanted to save it for the younger people. I tell you what, my congregants are really surprising me with the depth of their response to this and their outpouring of their heart. I'm going to ask Bonnie, what is it that you'd like to say then, Bonnie? I see your hands up.
There's a couple of things. In Connecticut, most of the parishes are making calls to their parishioners. And what we're doing in some of the larger parishes are that we are having lay leaders participate in those phone calls, in sharing those calls. It's an opportunity for them to be in community with with people from the parish, and in some instances, we are using people who are at a higher risk and definitely will not go out to the store, so that it helps them through their solitude. The second thing is we tried something on at our cathedral last Thursday night, and to Sarah's response that we need to make sure to take care of ourselves. We had a Virgin Mary cocktail happy hour, and anybody could Zoom in, and we played games. The dean had created, her husband created a wheel, and it had a question, and the question might have been, if you could be any animal, what would you be and why? If you could invite 3 people out to dinner, whether living or dead, who would they be? And it gave us an opportunity to take a break from reality. We didn't discuss virus. We didn't discuss what's happening in the government. We didn't discuss that we were stuck in our homes, but we had joy. And it was a great hour, and it went by so fast. And we will be doing it every Thursday night.
Great
until
idea.
this is over. So there are so many ways we can create community virtually.
Connie, could you do a short write-up of that and send it to me?
Yes, I will.
Thank you, Dee.
Thank you, Holly, for making that note available about using gloves to handle bags and then texting people once you're back in your car. That's a very good idea. Thank you. That's an answer to how volunteers can go out. Is there anyone else that has anything they'd like to share? We're getting close. We have 5 minutes left in the hour.
Connie, could I share from Missoula?
Please do, Dorsey.
Dorsey Davarskas here from Missoula, fellow Montanan in the diocese. And I was late to this call because I was on a call of about over 100 Zoom people connecting through our Missoula Interfaith Collaborative and the Broad-Based Community Organization, and got on and trying to see where we can rally volunteer forces beyond our congregations or our agencies where we are already deployed. And it was just a great connectivity. There were some city council members, some commissioners on to talk about not only what we can do on the ground, but thinking about policy things that we may need to be working on together. And obviously staying connected with the COAD team in the community. But what was shared, and when I'm off this, maybe I can just send it to Connie. It was a ready for action sheet that people could check off ways that they wanted to get involved beyond their neighborhood. And so we could rally people around those specific needs that are being lifted up from our various listening sessions that are going on in this time of great need. So I'll share that form out with people, and just really grateful for the community beyond our church family, and how rich that is right now.
Thank you, Dorsey.
Mm-hmm.
Julie, did you want to share where this is being recorded and where the recording is going to be found?
Before we finish, Connie,
Oh, sure.
I would just like people to respond, and you can unmute yourself and just jump in for about 2 minutes or 3 minutes to share. Has this been helpful? Would you like to do it again?
Yes.
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 Yes, yes.
Yes. Yes.
Absolutely, yes.
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 Yes, but probably not every week. I'm Zooming
Right.
myself to death.
Well, it's not mandatory again.
Monday nights seem to be a good night for me.
Yes.
Yes, I would say Monday night also excellent.
Yes.
Okay, that's a good enough response. I think
Yes.
then we can just say that we will have another one next Monday night, and we will continue as long as there are people that would be willing to participate. It will most likely not be, it'll be through AED. Julie has about
That's not true yet, Jan.
Oh, okay. Julie, why don't you take over from here and stop the recording?
So what I wanted to do was to show everyone the website where you can find the recording and to share this. Province 1 has a web page set up for diaconal ministry, and the link is in the chat. It has all of the recordings from the past 5 years that we've had of deacons talking. So this will be posted again, as will future ones, for you to be able to reference. We'll also send out the link to it along with the chat from tonight, since there are resources available. I wanted to note, here is the place where Virginia Theological Seminary is posting all of the recordings for the webinars that they're doing. So you can find that at eformationvts.org. And I'm also collecting on my Facebook page, this is an open group just for resource sharing, not only that link, but all of the links I've been finding of ideas of ways churches are responding to the virus. Some have started with worship, they've moved into a lot more pastoral care things. So if you have elements that you'd like to post and share, I am trying to collect them myself, in part to share with others and in part for research purposes. So I'd be happy to have your help with that. We've been pleased to have you be a part of this tonight, and I'll pass it back to Jan to be able to close us out.
Oh, I actually have the closing prayer.
Well then, Connie, thank you.
All right, just a second. And let me just share my screen, and I will share this with you, but the Lord be with you.
And also with you.
A Prayer for a Pandemic by Cameron Bellum. May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those who are vulnerable. May we who have the luxury of working from home remember those who must choose between their health or paying the rent. May we who have the flexibility to care for our children when their schools close remember those who have no options. May we who have to cancel our trips remember those who have no safe place to go. May we who are losing our margin money in the tumult of the economic market remember those who have no margin at all. May we who settle in for quarantine at home remember those who have no home. As fear grips our country, let us choose love. During this time when we cannot physically wrap our arms around each other, let us find ways to be the loving embrace of God to our neighbors.
Amen.
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 That is perfect.
Go in peace to love and serve the Lord.
Thanks be to God.
Thanks be to God.
Julie, can you stay on
Sure.
with Connie and I, please?